To roll the TFL and IT band, we're going to begin by identifying the TFL. So what I'll do is find right behind the ASIS here, that anterior superior iliac spine, the front part of the hip. We're going to identify the area. Go ahead and internally rotate your leg and you can feel for the TFL, it pops into your hand. We will position our foam roller right here for the TFL, and then whenever we roll the IT band, we'll roll down the leg here. When we're rolling the IT band, let's understand that what we're really trying to change is that vastus lateralis that's underneath it. You hear all the time people have a tight IT band, but really they have an IT band that's been tightened by the TFL, and then it's just sort of smashed into that vastus lateralis. So we're going to attempt to change that. So let's begin by positioning onto a flat surface. We're going to go into a side plank with this roller right there where we identified the TFL. Down onto the elbow. Top leg's going to be crossed over the front for a little bit of support. The TFL, to roll this area, what we can do is roll the hips forward and we can roll them back. It's a small area, so we can use this move to try to find the tender spot. Whenever we find it, we'll stop and hold. Be sure we maintain a neutral position here with the spines. We'll raise up just a little bit here. There we go, a neutral position here with the cervical spine. Maintain that compression for 20 to 30 seconds or until the tenderness starts to reduce. As soon as that's up, now we'll move to the IT band. So from here, we'll just begin rolling towards the knee. So you'll shift the elbow and this top leg, a nice slow roll, about 1 inch per second, maintaining the hips stacked on top until you identify the tender spot. When you identify it, stop. Hold pressure on that area for 20 to 30 seconds or until that tenderness starts to reduce. The IT band can be very tender. If we need to regress this, what we'll do is ask Claire to come up. We will use 2 rollers, so this way we're displacing more of the pressure and this should reduce some of the tenderness. It's a great way to regress rolling the IT band. So come into the same position, elbows down, nice neutral position here, top leg over for support, and now slowly begin to roll towards the knee. Be sure the hips are stacked on top of each other, and you'll immediately begin to notice there's less pressure, less tenderness. Find the most tender spot, stop and hold for 20 to 30 seconds or until that pain starts to reduce.